السلام عليكم، صبحكم الله بالخير جميعا. وإن شاء الله بإذن الله بنبدأ لقاءنا في هذا اليوم الجميل بموضوع حقيقة مرة مهم. ويمكن الكونسبت حق الكورس ده عن البيشنت اكسبيرينس براكتسز. ما أدري نبدأ ولا كده ننتظر حق دقيقتين نتأكد العدد شايفه بيزيد. ودنا الجميع الزملاء والزميلات المسجلين يحصلوا فرصة أنهم يبدأوا مع بداية اليوم إن شاء الله كده. بإذن الله حنبدأ نتكلم على موضوع مرة مهم. يمكن هو أساس الرعاية الصحية. ليش أنشئت الرعاية الصحية؟ ليش بدأت الرعاية الصحية؟ هذا الموضوع مهم جدا. طيب ويام تقول انتظر بعد إذنك. طيب ننتظر شوية. طيب ناخذ كمان 5 دقائق كده. طيب ونبدأ يصير اللي يعرف أحد من المسجلين يدعوهم إنه بدينا خلاص. ف let's take this 5 minutes sort of pause until everybody there. Okay? Enjoy your day. People around. So we'll start now. بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. So as we began our talk today going to be inclusively about patient experience. But before we departure, we need to know a little bit each other in general. So let's see the chat. How's the chat going to be? Busy or quiet? We are now about 50. So please let me know your specialty. I want to know, guys, what is your role in hospital environment? Are you nurse, doctor, technician? يلا let's see the chat. خلونا نعرف ايش تخصصاتنا. Hello, good morning. Doctor. Okay, excellent. Dr. Khalid. Yes, we go next. Usama Al-Harbi, good morning. Tamadur, dentist, welcome. Aisha, nurse, beautiful. Abir, public health specialist, great. مدير إدارة تجربة المريض، رنا, excellent. Muhammad, excellent. Doctor, excellent. Nurse. That's all. We are about 50, and I see only few. Nurse, nurse, nurse. Who else? Oh, good morning. It's a new year. مشرفة تجربة المريض. Great, بسمة. Case manager, excellent. Dental assistant, beautiful. أهلا سلطان المطيري. إيش تخصصك? What's your specialty? Beautiful. So let's make our chat busy this morning. Nurse, beautiful. أهلا وسهلا. Excellent. We're going to learn today very good learning, especially about the concept of patient experience, and how we measure patient experience, how we develop patient experience, the practice, the concept, and inshallah early this morning or late this morning, we will tackle also another topic about service recovery, how to recover the service when patient experience get down. All right, so we'll touch on these 2 major concepts today, but we'll start with the first concept. So until now, I just read few. Okay, we have Ahmed, pharmacist, beautiful. This almost 12 out of 50 participants so far. So who you are, guys? What kind of specialty you are holding? It is very important to know your specialty, so it eases my talk and the illustrations, examples, which needed to be used. Okay, Ahmed Al-Jihani, the last one here, is a pharmacist. Welcome. However, it seems the rest are writing now. Okay, so just keep me radiology consultant. Beautiful, beautiful. So keep rising, shine your specialty here in our chat. So that will give me more insight about to whom I'm speaking. So also myself, nurse Nauf Ali, welcome aboard. So myself as well is my training is a nurse, but actually I'm working now as a chief nursing officer in a system fashion. Yet my major interest is actually in patient experience. So I'm more doing consultation and facilitation training coach about patient experience. I'm practicing this years as a professional. Now almost ending this 30 year in this field. Yet I found this topic actually it's lifetime topic. So you'll never finish learning about patient experience because you will never finish learning about how to make your patient not only happy emotionally but safe and getting the expectation that the patients want from the hospital. And I learned this not only from the practice but also from being a father of very ill child with Edwards syndrome, as well as being a patient one day, almost a year in a hospital environment as a result of traffic accident. So it's more of a provider and recipient of patient experiences, which actually I would like to share with you today some of these concepts and some of the learning out of this. And I'm sure it's not about knowledge that we are giving you, is more of exchanging knowledge with you, as I'm sure this topic is well known to everyone here. But let's face it, my dear. Let's ask a big question today. What is patient experience? We're hearing patient experience. بنسمع عن تجربة المريض. ما هي تجربة المريض؟ إيش نعني بتجربة المريض؟ Many literatures, many speech, conferences, lots of things going on about this. But what is it? ما معنى تجربة المريض؟ يلا, let's make our chat active. ما هو معنى تجربة المريض؟ What is patient experience? Hello, good morning. What is patient experience? The chat is still quiet. Good morning, Gusa. What is patient experience? Wasmia. What is patient experience? Muhammad Sharif. What is patient experience? Mahmoud Agha. What's patient experience? Ahmed Al-Jahani. What's patient experience? Sultan Al-Mutairi. What is patient experience? ما معنى تجربة المريض؟ In simple word, تجربة المريض والشعور والتجارب التي يعيشها المريض أثناء تلقي الرعاية الصحية. Excellent هاجر. Excellent. More إذن هو الشعور والتجارب. So Hajar says that patient experience is about feeling and about the experiences that the person actually gets it within a hospital environment. رنا تقول كل ما يمر به المريض أو يسمعه أو يشعره في المنشآت الصحية. صحيح, هذه كلها بتكون تجربة المريض, بتكون الإطار اللي يشوف المريض إنه تجربة ويقول عنه. Yes, what else? يلا حركوا الماء, الصباح بدري, بداية السنة. Great. We need to have more share. I have only Hajar and Rana that share their thoughts about what is patient experience. Pick up and just say it from your own words. What do you think about patient experience? What is patient experience? ما هي تجربة المريض؟ رحلة المريض العلاجية. طيب, let me wake you up more. I know it's early morning. Okay. Impression and evaluation of the service done to him. Absolutely, Dr. Muhammad. Beautiful. What else? If you notice patient experience, we may have huge hundreds of definitions about patient experience. Yet patient experience has its own individual expectation from everyone. Now, if I ask you, for instance, question, let's just see our traditional way. You know, like the mama early morning says to her family, to kids and husband, hey guys, what do you like today in our lunch? بتسأل ايش تبغوا تتغدوا اليوم؟ ايش تبوني اطبخ لكم اليوم؟ فيول find every member of the family، كل واحد في العائلة عنده نوع من ال favor, certain appetite, certain likable food and so on. So that were the desire based and also the experience based. يعني those who like, for instance, salads, maybe not everybody likes salads, you know, like, so it's about the individual preferences. It's individual preferences. صحيح هاجر تقول التجربة لها علاقة بالتواصل مع الفريق الطبي وجودة الرعاية المقدمة وراحة المريض في بيئة طبية. يا سلام، excellent. هذه كلها مهمة أختي هاجر. لأنه البيئة الانفايرمنت it make huge difference. نوف also says here تجربة المريض هي تجربته في تلقي العلاج والخطة العلاجية. صحيح. Sometimes we may think about التجربة it's what I'm going to get, but sometimes it's also about the feeling of actually what I'm getting, the feeling out of what I'm getting. في مثل يقول people, they may forget what you done for them, but they will never forget how you made them feel about what you done. So الشعور اللي بيطلع فيه الإنسان من التجربة من الشيء هو اللي بيعمل فارق. فنرجع للمثل اللي كنا نقوله إنه everybody has his own view on his preferences or her preferences, and this is exactly work for patients. We may understand that there is a general needs of patients. We may anticipate, but the question remains, how can we get to know what patients actually they like or they prefer or what their perception about our service we give? Catherine says that patient experience about the process of receiving care feels like for your patients. Absolutely. And that's part of it. Because everything we do eventually will make feeling. I came into a hospital early morning. I found a smiley receptionist who was able to smile in front of me, welcome me. What will happen? I will get that immediate likable feeling. Oh, this is a great organization. If the receptionist is really smiling and welcoming. So my expectation that everyone after this line will do the same. يعني اللي في الاستقبال مبتسم مرحب، اتوقع انه بعد كذا كل الانكاونتر going to be same or better. This is also another way of how we look into patient experience. Welcome, Amr Ilyas. So that's kind of notion of patient experience. But let's dive in more deeper. I want to ask you another question. And guys, we are here. How many of us now so far? So let me see how many of us, mashallah. We are now 65. Hey, where our team? We're supposed to be more than this number. So let's now ask this blessed number about guys, what is your expectation when you come into a hospital? What do you see in a hospital? ايش توقعك قبل لا تروح المستشفى؟ الصباح انت ناوي تروح المستشفى مع احد عزيز عليك او actually you not as a professional but as a recipient of care. مثلا رنا تقول همي موقف السيارة الباركينج and how the security going to deal with me, the receptionist, and I'm going to think about the clinic and the x-rays. Hajar says the speed of service or perhaps the quality of service. So even I'm coming to a hospital but my mind is weird and busy. قاعد بفكر ايش بحصل. What else? ايش توقعاتنا؟ ايش تخوفاتنا قبل لا اروح المستشفى؟ What is your worry before you go to hospital? جودة الخدمة. عبير تقول أهم حاجة how is the quality of the service? Yes عبير بالضبط. أخ محمد يقول appointment respect. كيف حيحترموا موعدهم اللي ادوني هو. This is very important. العدوى نوف تقول infection. وقت الانتظار رنا تقول the waiting time. ماريا تقول الساعات الطويلة waiting long waiting. So احنا كلنا every patient come to the hospital. Imagine if his mind or her mind is weird and busy with this. So we normally came into a hospital with that fear, and this fear is actually introducing us to seeing and becoming more defensive of care. I'll tell you something. Now, as soon as you reach to the hospital while your mind is busy and worry about all these expectations, what happened then? You just came in and you find every single expectation and worries in your mind, you're just seeing it happening to you. Because your mindset is there, because there is something called أمجدلة hijack. إيش معنات أمجدلة hijack؟ الإنسان يوم يكون في خوف وقلق، Allah subhanahu wa ta'ala created in our brain something called amygdala. Al-amygdala actually positioned in the lower middle side of our brain, in the emotional component of our brain, where it has a function like radar, زي الرادار. So الأمجدلة شغلها, it's just trying to have a sense of what's going on, the threats, worries, fear, whatever that we don't like. This amygdala is immediately panicking and ready to capture this and expect this. And as soon as it becoming more and more, it's hijacking the brain. When it hijacks the brain, our ability to think logic and make decision and see the reality is in the place called prefrontal lobe. Prefrontal lobe, when the brain is in hijack, إذا الدماغ اختطف من الأمجدلة, البريفرونتال لوب الناصية does not function. So you cannot see what you're supposed to see. So because your brain is occupied with these worries. تخيلوا الآن أنا أجي المستشفى أحصل مواقف ما في. No parking. I park my car and then immediately message actually that I got fined, for instance. I got a receptionist who's actually not welcoming receptionist. Or maybe I come into my appointment and then the appointment was not on time due to many reasons. Or when I reached to the clinic, the doctor was not showing immediately as he was busy somewhere. Or maybe I'm fasting and I have a operation and then I went to the OR and then I keep waiting there and then they said, well, your operation is cancelled. تخيل الواحد صايم أكثر من 12 ساعة أكثر من رمضان ويجي العملية وتتكنسل. This fear center is the thing we evaluate. Yes, Dr. Muhammad. And the fear center is amygdala work hard on that because that's how it make our survive. Rana says مركز طب الأسنان تخصص بالضبط. That's example, for instance, from your own experience, and everybody has it. You know, like الديلي مشكلة. بالذات إذا رنا أخذت الموعد هذا من فترة طويلة, especially if you was looking and waiting for this appointment for a long time. So we do have a big number of obstacles that make patients unhappy. And it's not only about happiness, it's about health. Now imagine if you have somebody who's not able to meet his doctor on time. The appointment was delayed over 6 months, 8 months. And then imagine if you are just, la qaddar Allah, it's a newly diagnosed with diabetic, or newly diagnosed with cancer, or newly diagnosed with that disease, which may progress, which may progress more intense and more fast. So all this making not only the person getting happy or not, but making the health of this person deteriorate. So patient experience is really important domain of talk. So let's go back to our dialogue with the slides. Barakallah fikum. Thank you for your engagement. So let's go to the slides. So this is a just introduction. Now I want you to observe with me this short video, and then I want to hear your insight about what you actually saw and what is your reaction to this video. So let me just share the sound of the video firstly so we can hear together. Please advise if you can hear the voice. Share sound. Bismillah.
Patient Experience 101. What is patient experience? I remember the day I was diagnosed with cancer. Cancer. Other people had cancer, not me. I was a businessman. I was used to making decisions and thought I had control over my life. The diagnosis of colon cancer changed that. In an instant, I suddenly felt vulnerable and worried. Would I be able to work and support my family? I had one kid in college and a second in high school. I needed to be there for them and for my wife. I've had 2 surgeries now, and I've learned some things about being a patient. First, I can tell within seconds of someone entering the room if the caregiver is focused on me as a person. It's a sense of knowing they're there to help, rather than there to check on the progress of their patient or their project. I've also learned that being reduced to somebody dependent on others is really difficult. I want to tell that one nurse I'm sorry for being so quick to complain. It wasn't about her. It was really about me. I've also learned that the experience of being a patient happens in small moments that make the difference. A smiling face, rather than a sad look of pity, can brighten the moment and make you feel stronger. Every one of those brief interactions is just so important to the patient. There's one in particular that stands out to me. It was a man who was part of the housekeeping staff. He knocked gently, but entered confidently, and seeing that I was awake, said hello, and made an effort to use my name and even asked if he pronounced it correctly. He asked me how I was doing today, like he really cared about my answer, not because he was told that was the right question to ask. He went about his job of taking care of the trash and cleaning the room, but also stopped briefly when I commented about something going on in the world outside the hospital. 2 adults having a conversation made me have more belief there was life after this hospital stay than all the other medical things happening at the time. It gave me a little more dignity than I had been feeling at the time. And as I think about it now, it's like he saw himself as part of the team engaged in caring for people. You know, it would be great if each person in the entire healthcare system knew, and I mean really knew, how important they were to patients and their families. My wife and son, who have been through this with me, we talk about it, and I know what these moments mean to them too. What it comes down to is how each and every person and each and every interaction is 100% of their experience at the moment. But I know from having a business that it's not just the people who are face-to-face with patients, it's everybody behind the scenes too that makes the hospital or the treatment center or doctor's office work or not work. I know each and every person that took my blood, gave me a sip of water, took out the trash, handled my insurance, took part in my treatment, kept up with the latest research, managed the patient portal, kept the equipment working, or looked me in the eye and treated me like a person, have been a part of my healthcare experience and made this day possible. One of them told me how there was a time when each person who worked there wrote down on a piece of paper, "I am the patient experience," and held it up for their colleagues to see. I wish everyone would do that, because it's true, and I think it would really make a difference.
All right. So, hello, ladies and gentlemen. So what did you see in this short video? Let me see the chat again. Guys, you're really quiet today. Yes. ايش شفنا في الفيديو هذا؟ What did we see in this short video? What did we hear about the experience? Hello? Estelle? What patient experience then? What is the momentum? الانطباع الأول للمريض. Excellent, Rana. The first perception, the first encounter make difference. Absolutely, أخت رنا. وسمية says الاهتمام بأبسط الأشياء وأهم شيء الابتسامة. Taking count of every single things, even smiling. We may sometimes put lots of money, lots of budget to improve patient experience. Changing buildings, furniture, sofa, painting, color, videos, مش عارف, too many things. Yet we overlook to look into those simple things, which is really needed. Dr. Muhammad said we should expect too much effort to give. We should make too much effort to give the patient sense of confidence from the first look. Barakallah. That's important. The point that patients' expectation is not only to get the fancy system, is to get the human system in place. عندنا مثل يقول افرد لي وجهك, ابسط لي وجهك ولا تبسط لي سفرتك. So being able to smile and becoming more engaged with your guest is more than just open that big dining, big food, and big table without that human connection. So it's really make difference. What else you observe? Have you seen the rule of everyone? Everyone, housekeeper, health professionals, doctor, nurses, allied, admin, everyone. Did you hear him when he thought of, when he mentioned about his family? About the way actually that he being perceived by others. احنا الان لما ندخل المستشفى ايش بنشوف في المستشفى? What we are seeing always in a hospital, we see patients. We see patients. We see patients on bed. نروح الطوارئ. We see patients in waiting area. We see patients' family. Catherine says patient-centered care. Yes, in everything we do. So what we're seeing patient. But the challenge is, guys, the reality, these are not patients. These are human beings who have full story of life. And what we see in health professionals, we see doctors, we see nurses, we see admin, we see radiologists, we see pharmacists, we see admins. These are not only healthcare professionals. These are those are human who have a full story of life. You see, in one of the hospital I served, where one of the doctors was in his training. So they go in training R1, R2, and so on. So he was in his midway, and part of his activities, he need to work like on call. So he was on call for three constant days, and he was not able to sleep any time. ما قدر ينام مظبوط لأنه he was unlucky because this 3 days was so busy with too many patients, and he was surgeon. So he had to attend in OR and so on. So he had lack of sleep. I met him in the last day. قابلته في آخر يوم وكنت في الطوارئ وقتها وسلمت عليه هو ماشي البيت. ودعنا. Then after 1 hour he returned back after he got car accident. Unfortunately, we went into resuscitate him on ventilator, and all of us, we went into sadness. So this was not only a doctor. He is a human being with a full story of life. He needs to have a sleep. He needs to have a rest. He needs to be focused. He has family who loves him. The same goal for patients. This patient who's under your hand is not just a patient with this diagnosis. Patients in lab, he's not here just to take a blood. This is a human being who have full story of life. The patients in your clinic is not just there to take the medications. No, he or she is there to take full respect and full engagement as patient. In one of the encounter, a patient who was 70 years came into the clinic with his son. The son was a teacher, and the doctor was talking to those two gentlemen, but his focus was with the son, although the patient was the father. وكان يتكلم مع الولد ويقول له أبوك سوي له كده، إيش سوى أبوك، ويسأله. Then all of a sudden the father said, hey, أنا المريض. He said, أنا أبوه. I am his father and I am the patient. Why you don't talk to me? Just because I'm an old man? I can understand you. I can hear you. I am the patient. So how we observe this? When patients come to your clinic, how much attention you give to this patient? How's your empathetic listening to the patient? Patients come in explaining to you that he fall down, he lost whatever unconsciousness for a while, he got vomiting, he's in pain. And then you said, well, okay, we'll do this. But hey, you can do something more. سلامات ما تشوف شر. إحنا هنا معاك لا تخاف. Those words of making this patient calm, feeling relaxed, feeling humanly impacted, empathetically touched by you make difference. You as a nurse, you approach your patient to insert the cannula. And while you're inserting the cannula, you just came in silent. Hey, عم محمد أبغى أركب لك الكانولا. أعطيني يدك. Muhammad gave you his hand. You started inserting the cannula while you are silent. And then you just pick the cannula, you finish, goodbye. This is not a patient experience. This is just you satisfy your rule. But if you come into the patients and you start to talk to the patient, hey, good morning, عم محمد. صباح الخير, السلام عليكم, كيف حالك اليوم؟ ما شاء الله تبارك الله أمورك إن شاء الله طيبة. عم محمد أبغى أركب لك الإبرة هذه. I'm going to insert this cannula. And the purpose of this cannula, الهدف من الإبرة كده وكده وكده وإن شاء الله حتكون طيب. لا تشيل هم، أنا ممرضة محترفة. قد مارست هذه المهمة كثير. وإبرة بسيطة إن شاء الله. ما شاء الله كيف اليوم؟ كيف الأولاد؟ وكيف أمورك؟ How's your day? And so on. You inserted the cannula. You finish. You cover. Patience. You said to him, أمورك طيبة. تحتاج أي شيء تاني مني يا محمد. You left. This took from you the same minutes that took from the other example of just going and doing your task. So when we deal with patients, we are dealing with the full story of life. You came into ICU. Immediately when you open the door, you find your eyes goes to the monitor, observing إيش بيقول الcardiac monitor. Have a look. into the patient, ensure the patient's body intact. One of the videos, I'm going to share it with you later, is the experience of one patient who was in ICU ventilated, fitra, and then she was able to notice everything. I will share with you the video and see the impact of what we do, even if the patient is semi-unconscious or even if the patient's under ventilator. So guys, healthcare is beyond patient care. Is it? It is about human care. A patient who was 60 years old was in telemetry room, asked all of a sudden to go home. And everybody came in, كل واحد جاء قال له ليش تروح البيت، علاقات المرضى ومش عارف، قلبك تعبان، الدكتور شرح له، كل واحد جاء وقال له ما تروح، انت تعبان، قلبك عندك جلطة. الرجال قال لازم اروح اليوم، اخرج العصر، لازم ضروري اخرج البيت. جاله واحد من الموظفين وقال له سلامات يا عم، ايش السبب اللي بتروح البيت فيه وانت عارف حالتك؟ قال له يا ولدي الليلة فرح بنتي. Tonight is the wedding ceremony of my daughter and this is the only daughter I have. وهذه بنتي الوحيدة. And I'm worried that I may die. And I want to be with her in this moment. This hospital, they were conscious when it comes to patient experience. So what they done, they arranged for ambulance with the advanced team, doctor and nurse, and join that patient to attend the ceremony and return back. This kind of going more milestone in achieving human experience, more than just a care that we give. The care, my dear sisters and brothers, is not about the knowledge we had in the school or the certificate or the rank we have. It's about the human connection that we bring this knowledge and this care to those patients. This is what makes patient experience. And therefore, patient experience is everything we do. It's not only about the service,
Patient experience
but it's about the care, it's
101.
about the policy, it's about the procedure we do. في بيرل انستيتيوت أحد المعاهد العالمية الرائدة في patient experience. They define patient experience as, they said that patient experience is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. كل التواصل اللي بيصير في المؤسسة، الكوميونيكيشن، البوليسي، البروسيجر، التريننج، أولويات المؤسسة، الليدرشيب ستايل، الليدرشيب tactics, individual tactics and habit, this all becoming a culture، ثقافة. وهذه الثقافة هي اللي بتأثر في تجربة المريض، هي اللي بتعطينا الناتج عن كل الخدمات. The خدمة, the service in the reception, the service in the clinic, the service in parking, the service in inpatient, the service in every single journey of patients in healthcare. الكونكلوجن حقها يسمى تجربة. والكونكلوجن مش المخرج بس، الانتراكشنز which take place in this hospital. تعالوا شوفوا ايش يصير في الطوارئ. Patients come to ER seen by the doctor and the doctor ordered that this patient should be transferred to another specialty. What happened? Medical, they said, well, this is not medical. Send it to surgeon. Surgeon, they said, this is not surgeon, this is medical. Patients goes in that bargaining between two specialties while the patient's lying down in the bed just waiting for the service done. So you can see this conflict of who's supposed to take the patient, make the patient experience going down. This is part of our interaction. Our policy says 1, 2, 3, 4. No, 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 no. When we say no and we put policy that mismatch with patient experience, ايش بيصير؟ اليوم أنا دخلت المستشفى، عادتي آكل الساعة 10 في الليل، عادتي أنام الساعة 11، عادتي إذا نمت ما أبى أحد يصحيني لما أصحى اليوم الثاني، لأن لما أصحى يجيني إنسومنيا ما أقدر أنام. So what happened in the hospital? The habit which actually I used to have it, it's not available anymore in the hospital. The dinner time يقولوا لي الساعة 8 يا تاكل يا تنام جيعان. This does not work, my dear. Because I don't eat normally 8 o'clock. It's not my habit at all. And I don't have appetite to eat 8 o'clock. So the food that you bring, it will remain there. And then our policy says food should deliver at 8. And the kitchen should collect the whole tray by 9:30, for instance. So then our patient experience is against, because patients want to have some sort of flexibility. So therefore, even if we put policy as such, we need to make also some flexibility to ensure patient preferences of the time for the food and make it more aligned with the medications, with other interactions. Vital signs, nurse came in at 12 midnight، الساعة 12 ونص، الواحد نايم في حال سبيله، تيجي المرضى الصحي، vital signs أبويا. What happened? You'll have a heart rate, poo. You'll have hypertension, poo. Of course, you will never have that vital signs which is stable. You wake me up just now and you want to check my vital signs at 12 midnight. Why we don't reset our timing of care to match the patient comfort? I sat with my dad, rahmatullah alayh, as patient's watcher for about 3 months or so. I saw many things that I haven't seen it when I was in the position of managing hospital. You know, in just 20 minutes, not more than 10 times, not less than 10 times, people, they came in and out from the rooms of my father. Housekeeper, doctor, round, nurse. I said, oh my God, this is now happening from the daytime, early morning, until late evening. And then during visit, mashallah, you'll find visitors everywhere. And our system does not ask patients, do you like visitor or you don't like? Patients maybe want to sleep. So what happens if the patient has lack of sleep? Then patients hemodynamically will not be stable. In addition, maybe this also will have some interactions with his curable willingness and align with the medical regime needs. So therefore, patients' comfort within the hospital environment is essential. So you can guess and name many occasions where this can be achieved. هذه ببساطة إيش معنات التعريف حق patient experience. Patient experience begins the moment they choose or they refer to your service. Their experience describes their care journey from scheduling an appointment إلين ما ينشافوا، إلين وقت ما يكونوا في المستشفى، وقت ما بياخذوا الدواء, the time when they take their prescription, the time of the follow-up, whatever the outcome may be. So these all are the momentum where, guys, we are making patient experience. How do you know what happened to patients? How do we know what patients want? Simple question. كيف نعرف إيش يبغى المريض؟ يلا نسأل. نجاوب. Hello. How do we know what the patients want? كيف نعرف الشيء اللي يحتاجه المريض؟ ما هي حاجة المريض؟ How do we define the patient needs? Hello. How? نوف تقول يبكي. طيب من هو شخصيا نوف؟ excellent. نسأله. يا سلام. We ask the patient what is more. كيف نسأله مريم؟ How can we ask patients? الآن احنا نشرح له ايش البروسيجر اسميه. ذاتس مهم جدا. نشرح له ونسأله ايش رأيك؟ كيف البروسيجر هذه ممكن تصير او تكون جيدة معك؟ The body language, excellent إيمان. The body language, it tells us also what the patient wants. Yes, especially if it's refusal or discomfort. Absolutely. What is more? ايش كمان؟ خلونا ناخذ مثل. اليوم قررت العائلة تطلع طلعة. So we decide to go for outdoor. And then we said, well, guys, where do you like us to go? Of course, now the husband and wife telling to their kids, إيش تبغونا؟ فين تبغونا نروح اليوم? Why you ask them? You may decide you take them anywhere. No, because you want them to take the experience. So therefore, you want to know where they want to go and what actually make them excited. يا سلام، نعرف إيش بالضبط. لذلك لازم يكون عندنا أدوات قياس. Therefore, we need to have some measurement to ensure that we are measuring patient experience, not only to know their level of happiness. No. هل هم راضيين عنا ولا لا؟ لا. حتى كمان عشان نعرف what makes them happy. And what is their expectation? And what is their preferences? And that's what make the deal different. Okay. Excellent. So I'll go more. In Disney لما نروح ديزني بنعرف ديزني. في ديزني ايش بنشوف؟ ايش بناخذ؟ تجربة ولا بناخذ satisfaction؟ When we go to Disney, what we are gaining out of Disney, is it experience or satisfaction? No answer? Hello? Yes, 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 yes. Satisfaction? All right. Okay. Satisfaction and experience, Iman says. Excellent. Now, see your kids when they return back بعد ما يرجعوا من أماكن الفن تاون زي حكير ديزني. لما يرجعوا البيت ايش يقولوا؟ والله انبسطنا. It was great. It was fun. مش عارف. So their description, it's more about experiential description, isn't it? كيف كانت الخرجة؟ أوه روعة جنان. Why they saying this? Because they enjoyed it. And the big question here, whether in a hospital environment, patients want to be satisfied or want to get experience. You remember the examples we gave for the cannula? When you satisfy your action, you have a checklist to go introduce to the patient the procedure, give the patient the medication and so on. But within this, what you done, you talk to the patient, you calm the patient, you give some story to the patient, you give affirmation للمريض، مدحت المريض وشحن طاقته إيجابيا. You done all this, and then this is what you done. It make experience take place and satisfaction together. while if you just met the expectation يا الآن إحنا جينا قلنا تجينا الخدمة عندنا تأخذ 1 2 3 4 5 6 on time. We done this on time. You satisfy your work. You satisfy the needs, the service. الآن بريس جيني بيقيس لنا إيش؟ بيقيس لنا الإكسبيرينس ولا الساتسفاكشن؟ بريس جيني بيقيس لنا الساتسفاكشن. لأنه بيدينا عن الخدمة. الخدمة بتدينا الرضا، معدل الرضا. ولكن التجربة هي الناتج من الرضا هذا كامل. هل هي تجربة كويسة ولا لا؟ اليوم احنا لما نسأل المريض do you like this, do you like this, do you like this، في الأخير نسأل السؤال نقول how do you rate us? Do you recommend us to somebody, to your family, to your friends؟ بنسأله هل تنصح أحد بالخدمة تبعنا؟ هنا ممكن يختلف الرد. ليش؟ لأنه ممكن يقول لا هذه أنصح كل واحد يجي. واحد يقول والله خدمتكم كويسة بس صراحة عادية. إيش اللي مو عادي؟ أقول لكم إيش اللي مو عادي. في أحد الفنادق صارت لي التجربة هذه. في أحد الفنادق في مومباي. I was in Mumbai. I spent there about 1 month for some business. And then during my stay in that hotel, normally I'm not a person who acknowledging my date of birth. So, you know, and in this 50 years now, I'm just date of birth comes and goes. But what happened on the 20th of February, which is my date of birth, I just came back to the room. إيش حصلت في الغرفة؟ بالونز، كيكة، and وردة قد ايه كبرها كده، باقة ورد ورسالة وهابي بيرث داي أحمد. وشرعوا لي الغرفة، زينوها. I kept take pictures، ما سبت أي جزء من الغرفة إلا أخذت صورة وشاركت لي أولادي وعائلتي وأصحابي. يعني this momentum, this hotel, what they done, this extra mail event, it took them، حتى لو شفنا الاكسبنسز حقها يعني نفافيخ كيكه وزينه يمكن كلها ما تجي 50 ريال سعودي، بس عملت لي تجربه شخصيه عمري ما انساها. And think in everything you do in your hospital what you can do different, little bit different in your care. The little smile you share with your patient, not only this، بس كيف حالك اليوم؟ ما شاء الله ضغطك أحسن من أمس، ما شاء الله لا تشيلي هم، ربنا ما يضيع لك أجر، أنت أم مجاهدة، أنت أب مجاهد، ربيت وربنا ما يضيعك إن شاء الله، إحنا هنا معاك بعد الله. كلمات بسيطة بتشحن الطاقة الإيجابية، بتعمل affirmation، self confidence. ما هي زي مثلا سكرك مرتفع لازم تنتبه لنفسك، لازم تسوي. Patient has enough, but we need just to give them the experience they deserve. So the patient experience, in short, it's important. It has different domain because their perception, their preferences، الشيء اللي بينظروا له للرعاية، توقعاتهم من الرعاية، الشيء اللي يفضلوه في الرعاية كلها بتختلف من مريض لمريض. بس لو ركزنا على التعامل الإنساني، لو ركزنا على الهيومن كونكشن، لو ركزنا على الامباثي، التعاطف له 3 درجات. الدرجة الأولى من التعاطف يسموها cognitive empathy. Your ability to recognize the situation of your patient. My patient, yes, he has this diagnosis, but he's a father, he is a son, he's a husband or wife, he's a child, he's still in he's a young boy, young guy, young women. They still have their future. When you recognize all this, and being able to feel it. السكند نسميه emotional empathy. Bringing your feeling, because whatever we see others encountering, we encounter this in our life. And reflect. What does it mean to have this disease? You work in ER, the family came in to ask about their loved ones who you know he just passed away. You said, Matt. Oh my God. Or maybe you can have it in a human connection because you know the feeling of losing somebody. And you take this family in that human life and talk to them with empathy and engagement gradually to let them know the news and engage them and be there with them. This is what we call emotional empathy. Third, نسميه empathetic concern. Empathetic concern تسوي شيء. اليوم انت you recognize the situation of your patient. You had that feeling about the patients and you've done something. Doing something is simple. Smile. لا تشيل هم. خدمة بسيطة. Patient saw you in a corridor and he was looking. Patient asked what your patient met you in the corridor and he was looking to go to his clinic. And then you said, go right, go left. Patient lost. But with your kind care, you said, don't worry. تعال أنا معك, أنا أوديك. You hold that patience and you guide the patients. What happened? You make the experience. You got the reward from God Almighty. And you feel satisfied. Because when you do good, good come back to you. هل جزاء الإحسان إلا الإحسان. Once you do good for people, you will feel good. And then that goodness getting up and up, and you find yourself a generous of goodness, a person who have generosity of giving human connection, smiling, لا تشيل هم. You support your colleagues, you support this collaboration, supporting patients. I know one of the doctors who was leaving his clinic after he see any patients, like if a patient finish, he get out from his clinic and go to waiting area, talk to this, كيف حالك, كيف أمورك, لا تشيل هم, 5 minutes I will see you. So he was making the whole dynamic. And patients, they may wait for 2-3 hours without complaint. Because what happened, this doctor was, and then when I asked the doctor, he said, I feel happy. And then also he said, instead of just sitting on chair in the clinic and ask the nurse to call, I do myself, so I have like physical movement. And then he said, my patients all day feel happy. This doctor was the doctor of my dad, Allah yarham. And then we used to go there. We stayed there for 2 hours waiting for turn. My dad was in his 90s. Yet the doctor's compassion was make difference. Research shows those doctors or health professionals who practicing compassion, their patients' compliance in terms of medication regime, treatment regime getting high. وجدت الابحاث انه الاطباء والتمريض اللي يتعاملوا في الرعايه الصحيه اذا بيمارسوا الرعايه بالرحمه والكومباشن، المطاوعه حقت المرضى بتزيد في الرعايه وفي الارشادات. بل وجدوا في الابحاث انه patients who are optimistic عندهم التفاؤل، الاميون سيستم حقهم بيكون قوي. وجدوا الريكفري حقهم سريع after getting cardiac attack. The recovery also was fast after getting flow. And even for those who have cancer, their immune and their length of stay is longer because of the optimistic. So optimistic can be delivered with those compassion carrier health professionals. احنا العاملين الصحيين. احنا we can make it. And leaders who leading healthcare, they need to foster this. They need to make an environment where flourishing this, where people, healthcare professionals, they can serve. المقدمين الرعاية، الموظفين يقدروا يعملوا ويقدموا رعاية وتعامل برحمة. كل ما وجدوا هذه الرحمة والتعامل الإنساني في القيادات اللي بتقودهم. في الاحترام، في الانجيجمنت، في الريسبكت. That's how we make a health professionals, a staff, a receptionist able to smile, able to feel connected, able to see the needs and the empowerment of that compassion and empathy. Allah يعطيكم العافية. Thank you very much for your kind attention. And we will stop here. And then inshallah we will remain with my colleagues to join inshallah again the other topic relevant to patient experience. So please stay tuned, and I hope inshallah this session help you to recognize the significance of patient experience، أهمية تجربة المريض وإيش تجربة المريض، ومهما اتكلمنا في تجربة المريض نقدر نختصر تجربة المريض في قول الله تعالى: وقولوا للناس حسنا، قولا وعملا. Have a wonderful day. بارك الله فيكم. شكرا لكم. Thank you very much.
Hey, good morning, everyone. Assalamu alaikum. Can you hear me? Good morning. Can you hear me? Okay. First of all, thank you, Dr. Ahmed, for this valuable presentation. Thank you for the organizing committee and scientific committee for inviting us to this webinar. كل الشكر للمنظمين اللي أعطونا الفرصة مرة تانية نكون معكم بهذا الويبينار to share our experience, our background as nursing in this webinar. And we will be talking about the patient experience, that walking in the shoes of the patient. يعني كيف how you put yourself as a patient. As you know, as healthcare practitioner, we are working in a different units, and we are facing patients, we are facing families, and we are exposed to different type of patient who are critically ill, patients who are sick, patients who are coming for procedure, for operation. And our role is to support. At the same time, we need to put ourselves like you are a patient. For example, if you are working in emergency and you are facing a kids, one time your kids might be your patient. يعني نحن إذا بنشتغل مثلا اعتبروا نشتغل for example in the department of emergency facing a pediatric patient. ما يوم من الأيام our kids might be the patient. كيف نتصرف؟ فإذا دايما بدنا نحط we need to treat patient like we are the patient or our families are the patient. And this is when we say that walking in the shoes of our patient, like you are the patient, one day you might be the patient, and how do you want to be treated? A patient is the most important person in the institution.